So, hi, I'm Sherry Torres. I'm here with Jackie Stavros and Elizabeth Warner. And if you were not on the first call, Jackie and I wrote a book called Conversations Worth Having, which is all about how to make sure that your conversations support health, wellness, and your ability to thrive anytime, anywhere, and in any situation. And we felt like the COVID-19 pandemic was a time when we really needed to be having conversations worth having. So thank you for coming back with us, Elizabeth. And we would love to hear more about another situation where changing your conversations can really make a difference in this time of crisis.
Sure, thanks. If you weren't here in our first conversation, I'm a physician. I'm an internist by training, and I serve in Kalamazoo, Michigan as a medical director for folks who are in the community, our elders who are nursing home eligible, but we are actually serving them outside of a nursing home setting. And my background is both inpatient and outpatient, but mostly outpatient internal medicine care. I think one of the circumstances that has impacted anybody who is serving patients anywhere in America is really thinking about the scarcity around resources, and that can be the testing that's available and what criteria you need to meet to be able to get tested for COVID-19. It can be the resources in the hospital, and I think looming for everyone is the need for and the understanding of what the need will be for personal protective equipment. That's anything from protective eyewear, goggles, face masks, to surgical masks, N95 respirators, or other things to cover and protect one's nose and mouth from droplets, to gowns that may be necessary, and then gloves for reducing contamination of touching contaminated surfaces and then spreading that somewhere else. And that mindset of scarcity takes us to a very narrow, very laser focused place, which can be helpful a little bit, but not when you're doing this ultra marathon of a global pandemic. So I kind of call it like my Chicken Little moment, when I'm like, the sky is falling, we don't have enough PPE. And then I take a breath and come back and say, okay, that's a scarcity mindset. How can I think about what would abundance look like, or what would enough look like, or what would good enough look like, which is really different. And when we're thinking about taking care of folks, because we want to have the best all the time, and it might have to be good enough. So if I don't have an N95 respirator, do I have a surgical mask? If I don't have a surgical mask, do I have a homemade mask? And if I don't have a homemade mask, what are those opportunities out there that would allow us to consider a new possibility or see things differently, to be able to get enough of those resources to the healthcare providers and the folks that they're caring for? One story that we have here in Michigan is around a few private companies who are using their 3D printers to print N95 respirator masks, and hopefully masks that don't require special fitting, a special test to ensure the proper fit and cover for the mask. And there's lots of other stories. I'm not sure what else you guys have heard.
I'm from Michigan too, and I am so impressed with, of course, the automotive industry gearing up to produce respirators, and the collaboration going on in the eastern part of the state where Detroit is so hard hit, and where the automotive companies are. And the other thing I've been seeing, Elizabeth, is people who care a lot about the healthcare providers and the first responders, and they're getting creative. And I've seen on social media where somebody gave a bunch of cloth shoe bags for headgear protection, and bringing that to the hospitals, and they're just getting so creative. And the second thing I saw was a woman who started a Facebook site. I didn't realize that nurses and doctors and first responders, they go to hotel rooms away from their family at night so that they are physical distancing. And this woman started a Facebook page in 5 states asking people to are not using their RVs, rental vehicles, their RV homes, and bringing them to people's driveways, so the healthcare providers can come home at night and see their families. They're actually putting up tents in garages so that they would rather sleep in their driveways in a vehicle than in a hotel room to be closer to their families. It's amazing, the generosity and the creativity, and it's creating innovations.
Yeah, and I think there's, I read an article last week about a physician in Canada who, using some DIY, do-it-yourself techniques, took a respirator and jury rigged it so that actually 9 people could be hooked up to it. And since then, I've seen several other people talking about jury rigging respirators for at least 2 people, sometimes 3. So people are when they have the capacity to open back up, they're finding they can ask questions like you said, Elizabeth. What can we do, and what's possible here?
Mm-hmm. Yeah, and to have and to celebrate and savor all of the stories that we all just heard, so that we can stay in that emotional space and that cognitive space, to have the curiosity and the creativity to carry us through this. I think I called it an ultra marathon earlier, and it helps me just keep in mind that it requires training and recognize that it's not going to be magically over, and we can do it. And we can do it. And by thinking about how we can frame our questions and the work that we're doing, gives us the energetic bandwidth to continue doing it.
So once again, Elizabeth, you've shown us how to shift the tone and direction of a conversation to have better outcomes. And when you're in that scarcity mindset, that negative place, your ability, as you said, to just, again, pause, take a deep breath, and look at the conversations going on. Think about, you said the opposite, the flipping to the abundance. And then people are beginning to connect in their mindsets, generative questions, and they're really imagining how to put out more PPE or a different way to be using PPE. So that's really it's really important.
So we hope the 2 practices that we are sharing, generative questions and positive framings, will support you during this crisis. Remember to pause, breathe, and get curious. And then ask questions that help you feel connected and also inspire you, that make you feel creative and enlivened. And then take a moment to just receive the gratitude that people all over the world are sending you. Just to breathe that in. And when and if you ever have time to read anything, read the stories that are inspiring about what people in healthcare around the world are actually doing to meet the needs of scarcity.
And spread those throughout the world.
Yeah. Again, our YouTube channel is Conversations Worth Having. And for more information, our website is conversationsworthhaving.today. Blessings on all of you, and thank you so much for the work you're doing.
And Elizabeth, thanks for taking time out of your crazy work schedule to be here. It's on a Sunday with us. Thank you so much.
Yeah.
My pleasure.
And we'll look forward to the next conversation.
Take care, my healthcare brothers and sisters, and continue to support yourselves and know that you are not alone. Thank you.